What can influence the heart rate? Many different factors can influence a person's heart rate. In most cases, having a very high or very low heart rate is only dangerous when there is no obvious explanation. High heart rate. Factors that may cause a high heart rate include anxiety. People experiencing intense anxiety may have heart rates higher than 100 beats per minute, especially during a panic attack. Pain. Pain can cause the heart rate to increase. Pregnancy. A person's heart rate increases during pregnancy. Everyday activities also require more cardiovascular effort. So relatively easy activities such as climbing stairs or taking short walks can raise the heart rate more than usual. Pregnancy may also cause heart palpitations or an irregular heart rate. Fever. A fever or exposure to intense heat can sometimes cause a high heart rate. Caffeine. Caffeine can increase both heart rate and blood pressure. Medications. Some medications such as selective serotonin reuptake inhibitors or drugs for attention deficit hyperactivity disorder or ADHD may affect heart rate. Worrying about having a high heart rate may cause it to rise further. Taking some deep breaths and trying calming exercises can help a person assess whether they need to be concerned about their heart rate. If there is an obvious cause of a heart rate change, such as pain or a fever, a person can try addressing that first to see if the rate returns to its usual level. Postural orthostatic tachycardia syndrome. A person with postural orthostatic tachycardia syndrome may experience an increased heart rate upon standing up. They may also experience dizziness and a drop in blood pressure. Postural orthostatic tachycardia syndrome is a condition of the autonomic nervous system. It happens when this system does not properly regulate bodily functions such as blood pressure, heart rate, or breathing. Low heart rate. In general, the lower a person's resting heart rate, the healthier their heart muscle. However, a very low heart rate can indicate a problem with the heart's electrical system. A low heart rate is an emergency for a person with symptoms of illness, excessive bleeding, a recent serious injury, fainting, or dizziness. According to one 2020 article, the following factors may lead to a person experiencing a low heart rate: chest trauma, heart disease, heart attack, treatment for congenital heart disease, sick sinus syndrome, radiation therapy, amyloidosis, pericarditis, Lyme disease, rheumatic fever, collagen vascular disease, myocarditis, muscular dystrophy. There are some medications can also cause a low heart rate. Determining the cause of a low heart rate means a doctor can treat it accordingly. This may involve treating an underlying condition or changing the person's medication. The heart responds to the pressures the body faces, and it may change its rhythm according to the muscle's demand for blood and oxygen. However, when heart rate changes appear to be random, are long-term, or occur with other symptoms, this may signal an underlying medical problem. Only a doctor can diagnose the issue and treat it accordingly.